And let's now bring in Dr. Bonnie Henry, BC's Provincial Health Officer. Doctor, good morning and thank you for your time on CTV News channel.
Good morning.
Can you walk us through the recommendations and who exactly they apply to?
Right, so it applies to everybody in the healthcare setting in patient care areas. So in areas where we know there are people who are most at risk of having severe illness or complications from all of the viruses that we tend to see circulating this time of year. So it applies to hospitals, to long-term care homes, to the associated clinics that are along with the hospitals as well.
There was, of course, some doubt, Doctor, in the language that was used in this order. Many were questioning what does it mean to be wearing a mask continuously, as it was said, continuous masking versus mandate or mandatory. What would you like to say?
Yeah, I think you're parsing words. So it is wearing a mask all the time when you're in those patient care areas. So very similar to what we had in place during the pandemic, but limited to the areas where we know there are vulnerable people. So we had a much more stringent mask requirements during periods of time when there was a lot of particularly COVID circulating, and we knew that there was transmission between healthcare workers and others. So now we're focusing on those areas where people are most at risk.
Okay, now you also say that self-checks will be required by healthcare workers and screening for anyone coming into those facilities. How will all of that be enforced?
Right. So healthcare workers always do self-screening. We're just reminding them to take that check. And these are things that all of us should be doing. How am I feeling today? Where am I going? Am I going to be with somebody who's more vulnerable? If I'm feeling off or if I have a bit of a cough or the sniffles, postpone that visit to long-term care. Those are the things that we do to make sure we're not bringing viruses into those settings. So what we have in place is ambassadors or people who work at the doorways to healthcare facilities, to long-term care homes, to do that check with you, to just say, hey, how are you feeling today? Do you have any symptoms that might indicate that you have a fever or a cough, things that might be transmissible to others? And to ensure that people have access to masks at the entrance to facilities as well.
Dr. Henry, some emergency room doctors are asking for universal masking in BC's emergency departments. What are your thoughts on that?
Well, that's essentially what we have, and certainly in patient care areas, so that means waiting rooms and waiting areas of emergency departments. The slight caveat that we know is important is patients, for example, who are coming into an emergency room, they can't always put a mask on. It may be trauma, it may be the reason that they're coming in, but absolutely, if somebody's coming into the emergency department, sitting in the waiting area, we will expect most people to be wearing masks. And that's the normal thing that we should be expecting this time of year when we have a lot of transmission, or as we go into the period of time where there's more risk in the community,
Right.
There's more risk. We're going to bring that into the healthcare setting too.
I was actually going to ask you, what is it that you're seeing in the community at the moment at hospitals with the season really coming in?
Yeah, so we're starting to see an uptick, not as much as we did last year. So we're not seeing very much flu yet, thankfully. We are starting to see increases in COVID transmission and some of the hospitalization that we're seeing. So we still measure anybody who has a positive COVID test in hospital, and that's what we're reporting on. We've had a couple of clusters. So we've had some added testing being done in hospitals around those people who brought COVID in with them. So we're starting to see the increase, and now's the time to take all those measures that start to protect you. Really important to get the flu shot, to get the updated COVID vaccine, and both of those are starting to be available here in BC and across the country, starting this week for long-term care, and then we're expecting that we'll be able to roll it out broadly to most people around October 10th.
For Canadians watching you at the moment, you did, of course, speak on vaccinations at the moment. We know that Health Canada has also approved the latest vaccine, attacking the variants of Omicron. Your thoughts on how essential it is going to be in this season where vaccination is concerned?
It's been a long time since most people have had a vaccine, and we know from the seroprevalence data, and I presented some of that yesterday, that there's still a good level of that long-term protection against severe illness that most people have from combinations of multiple doses of vaccines and often an infection. Many of those infections are quite mild or were not known by people because of of the protection they get from the vaccines. But now's the time to get that better protection for the coming months. And this new updated vaccine looks like it's protecting well against the circulating strains that we're seeing now. So these modified are the newer ones, the XBB and EG.5, and the ones that we're seeing causing illness right now. The studies show that these vaccines seem to be really good protection against those, and they protect you from getting sick in the first place, as well as boosting that protection for severe illness and hospitalization. So I encourage everybody, I'll be getting mine as soon as it's available.